In India, psychiatrists are conducting interviews for the selection of clinical psychologists. Psychiatry is indeed a common subject that both clinical psychologists and psychiatrists study. However, the difference is in the approach they both take. Some psychiatrists are mostly focused on the medical model of mental illness, and even though other etiological approaches are given in their curriculum, traditionally they are taught to pay more focus to the medical model of mental illness. Whereas a clinical psychologist tries to understand psychiatric disorders from different points of view via different theoretical glasses, so that he can make a therapeutic formulation. A clinical psychologist's work is more in-depth than a psychiatrist. In a regular hospital setup, a psychiatrist would give a time ranging from 5 to 15 minutes maximum to a single patient due to the flow of cases. Whatever the reason, 5 to 15 minutes sounds very little to me for a proper evaluation. This is also happening because options for medicine in psychiatry are very limited. Moreover, if they are high, they will make a wrong diagnosis and will choose the wrong medication for their patients. Some do it on purpose to keep the patient ill or less improved so that they can earn more from them. This is the most disgusting approach I have seen in psychiatrists, especially who work in private settings. But that's a fact. On the other hand, clinical psychologists do not have the luxury to even normally finish their evaluation in just 10-15 minutes, as theirs is mostly in-depth because of the perspective they work, which needs deeper evaluation. A clinical psychologist's work is more intensive and more time-consuming. They have to keep changing their hypotheses as per reaction coming to their therapy, and this all is a total mind work. A well-trained, knowledgeable, and updated clinical psychologist must work more than 15 hours even when they are off duty. For a clinical psychologist, it can never be 9 to 5 p.m. job hours. The gist is, how can a professional such as a psychiatrist take a selection interview for a clinical psychologist? Maximum they can take a mental tour or learn psychiatry knowledge. But psychiatry is not just the only thing a clinical psychologist has to learn. How would a psychiatrist evaluate the knowledge of theories, therapy, approaches, etc. of a clinical psychologist in any given interview? The problem is that psychiatrists are enjoying a kind of dictatorship just because common people never update their knowledge base. And their belief system is based on that same old-age, outdated belief that medical pills are the only cure, where the truth is that pharmacological treatment is just part of a holistic intervention, though it is significantly ignored in our county.